Good afternoon. My name is Ajay Bailey. I'm Professor of Social Urban Transitions at Utrecht University. Today, I'm going to speak to you all about the challenges and opportunities of conducting interdisciplinary research on health sciences or healthcare on Curaçao. Before we begin the discussion on interdisciplinary or challenges or opportunities, we may want to first think about what do we define as health as we look at it from a more multidimensional perspective. We may want to think about health also not just about being ill or being sick, but also the larger environment and the social context in which health or healthcare access plays a role. People being ill, the long-term illnesses, short-term illnesses, infectious diseases, all these play a role within this. But in addition to that, we also have issues around access to hospitals, access to mental health care. All these play a role in understanding health from a broader contextual perspective. To begin with, we should first look at what are the socio-economic conditions that trigger certain health conditions. What are also socio-economic conditions that could act as particular barriers in accessing care, in accessing medicines, for example. The rising costs of medicine, the rising costs of healthcare also prevent people from accessing these situations. Even when you can afford the care, maybe sometimes people are not able to access this care because it's too far away, or it's not available, or they don't have that particular expertise. Whatever the condition is, we need to situate these conditions before we start to look at the individual health needs. Hence, when we talk about health, not just from a medical perspective, from a rather social or a political perspective, we need to look at socioeconomic conditions. We need to look at the histories that play a role in defining how the health system has emerged, what have been the colonial relations, for example, how has past influenced the current structure of health systems, have the policies changed, or is it still 100 years old? All this plays a role in how we understand healthcare systems, healthcare provision, and also how do people work within these healthcare systems. When we go one more step further, we have to look at what is the situation in which people live. Is it about climate change? Is it about increasing situations where food security is compromised? Is it about situations where there is sea level rise? Living on an island, for example, in Curaçao, brings with it the larger context about how climate change, the impacts of climate change, are largely felt within these groups. In addition to the impacts of climate change, it's also what have been the histories of infrastructures on these particular islands. In my last visit to Curaçao, I saw this large decaying oil refinery that is taking place. I was also wondering, okay, you may think of it as an economic case, but it is also a condition that affects health of people, because in terms of that it rusts, it pollutes the environment, and how that pollution actually comes back to affect individuals within these communities. In addition to looking at these particular elements, we need to see what are these interrelations between these particular concepts. We don't look at colonialism or socioeconomic condition or racism or affordability and all these kind of things independently. We need to bring them together. We need to see how these different elements intersect to create vulnerability or to increase vulnerability in certain groups. By conducting interdisciplinary research, we are able to bring these different elements together. I'll give you all two examples of how we have done this on Curaçao. The first is an Arbocarib project where we look at dengue, Zika, and chikungunya. This project was headed by medical microbiologists together with colleagues from the Curaçao Biomedical Health Research Institute, and there are people who are sociologists, entomologists. I'm personally also an anthropologist working on this committee or this group. And there we already see that it's not just about looking only at whether there's an infection or there is a health condition, but it's taking the whole perspective. And it ranges from going on accessing, did you go to your GP or general practitioner, to also understanding how waste management and or rather non-management of waste plays a role in increasing infections on the island. So all these elements we need to combine, especially in this project. We look at it from so many different perspectives. By combining these different perspectives, we can understand in what contexts do healthcare preventions work, in what context do they not work, where is behavior change possible, and in what context behavior change is not possible because of the distrust that these people have towards the government. So any new change or any behavior change that you would recommend would be met by distrust, and there's less likelihood that people would change their behavior. In a second project that we are currently conducting on Curaçao, Aruba and St. Martin, we are looking at the social impact of COVID-19 or the COVID pandemics, and examining how risk information or risk communication during these lockdowns had an impact on people's lives. There, we also take these kind of multidisciplinary perspectives, where we don't look at social impact only from the perspective of poverty or from the perspective of isolation, but we combine these different elements. We also look at what has happened before and how does that have an influence on their current situation, and what kind of resilience capacities were available or adaptive capacities were available for people to overcome their situations, and for whom it was more difficult to overcome in these situations. When we combine these different disciplines, you may think, oh, we can just put them together and they will find their way. It's not that easy. Doing interdisciplinary or even transdisciplinary research comes with its own challenges, because each of us come from a very specific disciplinary lens. And when we combine these different lenses, there are always places where things converge, but there are also places where things diverge. And it is in these divergences that we have to sit together to find out why do we diverge in these opinions, and where is that convergence possible when we adapt methods or adapt concepts or adapt ideas even, so that we can reach the ultimate goal. It's more important to have a shared vision of where you want to go with the project when you're doing an interdisciplinary project, rather than focusing on methods per se. Methods come as a next feature. Once you have achieved a shared vision, where do we go next? So in both these projects, we try to combine people from different areas who bring in their own expertise, and look at how we can bring this congruence between these different disciplines. The next step, of course, is conducting the methods. You may have realized when we combine different disciplines, they come with their own methodologies. For me, for example, I've been trained in anthropology. So for me, the first important thing that I would be interested to do is to understand people's perspective, right? So to understand people's perspective, you need qualitative research methods. And qualitative research methods which are done systematically in a rigorous manner, which can yield results that you can communicate to a larger audience. In a similar way, when you do quantitative methods, you would also use the similar principles, that it has to be rigorous, it has to be reproducible, it has to be generalizable for a larger population. Right? So, but when you combine these methods, that's where you have to start to think, in what way am I going to combine these methods? Or you may have heard of mixed methods. So when we mix methods within interdisciplinary projects, you may also want to think what comes first and what comes second. Yeah. In this project, we also did that. We first followed a cohort of people who had been infected with chikungunya. We followed them at a 2-year period and at a 5-year period. And during these times, we also interviewed these people. So in that way, we have a quantitative data set that talks about their experience, but we also have a qualitative data set which talks about how the people experience these conditions 2 years later or 5 years later. So what kind of symptoms remain? By combining these methods, we also get both, one, how far is it, what is the prevalence of it, how many people are affected by it, but you also get a lot more of the thick descriptions or the people's perceptions or lived experiences of living with the condition. By combining both these elements, you can see that you have a more nuanced understanding of how that particular condition or a disease or illness or infectious conditions have played a role in the lives of people. So that is at an individual level, but you can also examine how that has played a role at the family or community levels, depending on what kind of methods you would use and what kind of approaches you would take to study these particular groups. And more importantly, which groups easily agree to participate and which groups are reluctant to pass. When people are reluctant to participate, that also tells us a lot about what are the local tensions or social tensions that exist in this group and how we can overcome these tensions. I would also like to talk about issues around capacity building, because it's not just about doing research on the island or doing research in the Caribbean. It's also about capacity building on how these research projects should not be seen only as data collection points, as that we don't go just to Curaçao or to other places only to collect data, but how these projects can actually improve capacities for research on these islands. So when we talk about capacity building, we have to also understand that we can't just replicate structures from Netherlands to the Curaçao. We need to understand what is the need over there and what is the available capacity and how we can train this thing. In my previous projects that we have done in India or in Bangladesh or in Tanzania, there we went from a perspective of understanding capacity building that is locally relevant at that particular context. When we cannot just overnight expect that research systems will work or research projects will start without investing into the capacities in this region. So I would actually make a plea that we have to create the right research infrastructures and develop these infrastructures for the long term by improving capacities over there, by investing in people, investing in resources, investing in time to train these people for the research. Also by bringing people from different places to contribute to this, because true co-creation happens when you can bring local issues, local needs, local capacities together and combining them with more global issues that exist. So at the end of the day, it's not just about conducting a research project and being done with it. It's about what responsibility do we have towards people. By conducting health research or the challenges and opportunities that we see of conducting research on health, finally it's for the people. How are we bringing this information back to the people? And in what format are we bringing this paper? Is the research process done in a fair manner? How can we improve these processes? And it won't be done in a day's time. You have to invest time. There will be mistakes. There will be debates, discussions, frictions. But these are all part of conducting collaborative research. And more importantly, part of conducting interdisciplinary research. Because when you have discussions, debates, dissents, that's where you start to learn where are these boundaries, where are these bridges that can be placed to bring these different groups of people together. So we as researchers, we have a responsibility to bring research back to the people, but also to continue supporting and building capacities and learning from each other also among co-researchers. So in this week, when you meet other researchers at keynotes, when they're making their presentations, look for opportunities where you can build these bridges with researchers across the Caribbean, but also here in the Netherlands, and everyone who's willing to participate. I wish everyone a great week ahead, and I hope we could meet in person soon, either on one of the islands or here in the Netherlands. Thank you.